Bismillahirrahmanirrahim. Hello everybody. A 35-year-old woman come to the office for her first prenatal visit. The patient has been married for 8 years and has tried to conceive for the past 3 years. For the past few weeks, she had experienced morning sickness and has a abdominal distension and breast fullness. Her last menstrual period was 2 months ago, and a home urine pregnancy test was positive. She has no medical problem and has no surgery. The patient take a prenatal vitamin daily. She does not use tobacco, alcohol, or illicit drug. Blood pressure is 110/60, pulse is 72 per minute, BMI is 24 kg. Physical examination show a soft, non-tender, tympanic abdomen with no masses. Bedside ultrasound reveal a thin endometrial stripe. Two office urine pregnancy tests were negative. Which of the following is the most likely diagnosis? Early pregnancy, ectopic pregnancy, hydatid mole, mass abortion, polycystic ovarian syndrome, premenstrual syndrome, and pseudocyesis. So first of all, I will write here that what are the hint in this question. So first of all, this patient is trying to conceive for the past 3 years. This is the first hint. Conceive for the past 3 years. The second hint is that this patient experiences morning sickness and abdominal distension with breast fullness. This is the second hint. The third hint is that on home, the 2 months ago, she having a home urine pregnancy test which was positive. Pregnancy test was positive. This is the third hint. The fourth hint is that on ultrasound, there is a thin endometrial strip. And on office, the pregnancy test was negative. Pregnancy test was negative on office pregnancy test. So this is the fifth hint of this question. So based on this fifth hint, what is the diagnosis of this question? So first of all, this patient conceived for the past 3 years, but unfortunately she haven't succeeded in for conceiving. Second hint is she having morning sickness, abdominal distension with breast fullness, and on home urine pregnancy test she having a positive urine pregnancy test. On ultrasound, there is a thin endometrial strip with on office visit the pregnancy test was negative. So based on these 5 hint, the diagnosis of this question is pseudocyesis. This is a psychiatric disease in which the patient falsely believes that she is pregnant. So here the correct option is option G, pseudocyesis. So I will explain to you that what is pseudocyesis mean. This patient present with amenorrhea, breast fullness, morning sickness, and abdominal distension, symptom of early pregnancy, and believes she is pregnant. However, her office examination, which involved thin endometrial strip, negative pregnancy test exclude pregnancy. This presentation is consistent with pseudocyesis. Risk factor include a history of infertility. As we can see here that this patient have a history of infertility. She been trying to conceive for the past 3 years, and prior pregnancy loss. Pseudocyesis likely occur when the somatization of stress affect the hypothalamic pituitary ovarian axis and causes early pregnancy symptom. This patient belief is often strong enough that the patient misinterpret negative home pregnancy test as being positive. Management requires psychiatric evaluation and treatment. Choice A, early pregnancy. So early pregnancy test is excluded in this patient by the negative office urine pregnancy test. Choice B, ectopic pregnancy. So an ectopic pregnancy can present with a positive office pregnancy test. EC, Hydatidiform mole. A hydatidiform mole is typically associated with severe nausea and vomiting, uterine size greater than dates, and increased beta HCG and increased beta ECG. Choice G, missed abortion. So, patient with missed abortion has a pregnancy test positive and ultrasound reveal a non-viable intrauterine gestation. Choice E, polycystic ovarian syndrome. Polycystic ovarian syndrome on ultrasound having a polycystic ovaries. F, premenstrual syndrome. So premenstrual syndrome can present with breast tenderness and nausea. It is associated with a regular ovulatory menstrual cycle, but not with the patient belief that one is pregnant, that she is pregnant. So here the correct option is choice G, pseudocyesis. I will once again explain to you that what is pseudocyesis. It is a false belief in which the patient believe that I am pregnant. The risk factor for pseudocyesis include infertility, as we can see here that this patient being trying to conceive for the past 3 years. So this patient has pseudocyesis, which is a false belief that she is pregnant.